This next case I want to share with you is a 49-year-old gentleman, African-American, who sustained what I consider, it's actually not what I consider. It was an aggressive, in parentheses, malignant meningioma. And I wanted to show you first the slides that I usually take multiple sections through. And you can see here's the first few sections here. And I take many sections to highlight the specifics and detail structures of the tumor. And I'm going to select one of the slides to show you. And here are the remaining slides from the tumor section. Okay, so what I want to do now is take you to the microscopic. I'm going to select a random slide to show you the specific details of the tumor. Well, as I began to show the video of the malignant meningioma, I wanted to kind of scan around. I had a dilemma here because I had a number of slides that I could have shown to show this aggressive malignant meningioma. But I'm going to start here. I mean, you can see some brain tissue there entrapped with some necrosis around it. But I'll go down to the closer to show you this is kind of relatively intact brain tissue here. And but I wanted to show you just overall pattern, and then we'll go down and kind of define this tumor in general. So let's see. Let me just keep on going around because I wanted to show you what area that this tissue was perhaps taken from. Well, not perhaps, it was taken from, because when you see, if you're able to identify brain tissue, then you should know some basic anatomy. So there's still some brain tissue here, and here. There's a cerebellum here. And if you look over, you can see actually the tumor invading cerebellum tissue. So this was a fourth ventricle malignant meningioma that extensively involved the brainstem and also caused herniation as well. The person had several rounds of, this is just relatively intact cerebellum here. The patient had several rounds of radiation, 35 I think it was. And so initially diagnosed about 3 years ago, and succumbed to the illness ultimately. But he I think died about 2 weeks prior to being pronounced dead, and basically the heart basically gave up. The heart succumbed to, kind of gave up. The heart basically gave out from sepsis. He developed a decubitus ulcer with sepsis, and decreased heart rate and low pressure basically caused him to be sent to the hospital. But be that as it may, let me go down and focus on this tumor here, because the clinical information is somewhat depressing. But we're going to go down and take a look at this this meningioma. I mean, right here it looks like your classic meningioma, but we're going to go down even further, because there, as you go closer, you can see some more cellular anaplasia and pleomorphism. But let me see. You can see the fibrosis around the blood vessels there, which is classic meningioma. But look how the cells are beginning to take on spindly forms now. Still within the realm of meningioma, but I want to keep on perusing around. In fact, I'm gonna go down here so you can see a little more nuclear pleomorphism, which let me see, that's still not bad. Let's see, I thought I had a better view where the cells were actually gigantic and anaplastic appearing. You can still see a little more pleomorphism, but still, and then that's wrong. Let me just go back so you can see what this looked like. So typical of meningioma here, but given the fact that it was invading brain tissue, and I had more, okay, there's some necrosis there within the tumor itself. So you don't typically see this level of pleomorphism with necrosis and invading into the brain with your typical meningioma. But let me just go around, because I thought I had a little more convincing anaplasia than what we're seeing here. But that's still quite a cellular tumor. And okay, as I continue, now we're getting into a little more cellularity and pleomorphism of the tumor cells. And these tumors are extremely rare, particularly but in the subtentorial meningiomas tend to be very aggressive and often malignant. So I advised the patient, I think the patient had just only one son, that perhaps a surviving family member should be screened for meningioma. I think there is a genetic component to meningioma, so I advised that. But this was an aggressive tumor that invaded the surrounding brainstem tissue, including the cerebellum and some of the other structures. I think it may have arisen from the choroid plexus area, or at least some of the meningeal tissue from the choroid plexus area. But again, we will see here a little more pleomorphism. See the spindly cells? That's very hyperchromatic and spindly, a little more pleomorphism. But some of this could have been radiation changes, but some of this also could have been the de novo aggressiveness of the tumor. And we would have required to look at the original pathology from the institution that performed the original surgery, but we were never afforded that opportunity. Be that as it may, this was signed out as an aggressive, in parentheses, malignant meningioma with subsequent brain herniation and brain death. Okay. Also, and finally, I couldn't help but show you some of the Samoma bodies here. That is classic with some meningioma, and so you can see the Samoma body or calcification here within the tumor itself. A little more pleomorphism here too. So just wanted to kind of show you the Samoma bodies, and there were some more definitive areas, but this is good enough for Samoma body calcification. Thank you for, and look how extensively it invades this capsule, the meninges themselves. So this is not your benign type of meningioma. This is a very aggressive meningioma. Thank you.